Hey guys, John Lee here with AFC International. I wanted to talk to you today about a little bit what's going on in the world. COVID-19 is something we have never seen. We don't have a lot of experience with it. The world's kind of going crazy. We got lockdowns, people dying, lots of people sick. A lot of people are scared, empty shelves. So yeah, we're feeling it here too in Indiana, just like everywhere else. But I want to talk to you a little bit about some more about respirators, what respirators you should be wearing, what respirators are not working, a little bit about fit testing, the OSHA standard 1910.134, what that means for you in the healthcare department and also the industry. What's that going to mean for you? So yeah, let's get started here a little bit. Going right into the respirators themselves, I've seen it all. I've seen kind of some crazy pictures on Facebook, just like everybody else. They got people in bags. You got people putting bottles over their head. It's crazy. It's ridiculous. It doesn't work. Surgical masks. People are going crazy over surgical masks. Surgical masks are not going to work in this case. It's not going to protect you from COVID-19. Those are designed more to protect the person who's wearing them from breathing onto a patient. What you're going to want for this case is an N95 or greater. The N95s are going to come in different variations. I have a couple here to show you. You got a couple different styles. So this looks almost like a surgical mask, but this is a N95. And what makes it an N95 is the filter material is going to be a better filter material. There's going to be more filter material to it. And then on the top of these, you can't quite see it from, I'm sure on the camera, but inside here is a little metal bar. You can see it better on this N95. You got the plastic bar on top. That's going to help hold that and secure that to your nose. And then you're going to have your two respirator straps. Now, who should wear a respirator? Who should not wear a respirator? I'm out of luck. I got a beard. Any respirator is not going to work for me. I can put on a full SCBA mask like a firefighter and have air on my back. It's not going to do that great because I got some scruff going on. Wherever that respirator seal is going to fit on your face, you can't have any hair there. You're okay if you got a mustache, you've got a little bit of chin hair. You just got to make sure that that's not coming in contact with the seal against your face. If that's the case, it's really useless. You're still going to get exposed at that point because you're not going to have a tight seal. And say the coronavirus is very small, it's going to be able to get itself down inside that mask. So how do you know if the mask fits? How do you know if there's leaks going on? In the industry, we use fit testing. You get qualitative and quantitative fit testing. I'm not going to go into that right now, but yeah, you need to get fit tested. Make sure these masks work. The individuals who are buying these for themselves, for their kids, for their wives, husbands, yeah, you're not going to be able to really fit test at this time. And quite frankly, you're really not going to be able to find anybody to fit test you. This is more towards the industry, towards the medical field, and what OSHA is going to do when it comes to the fit testing and their standards. So 1910.134, like I say, is the OSHA standard. Basically, so as an employer, if you're going to have your employees wear a respirator, and it's mandated, no matter what the reason is, they want you to fit test. Say there's a couple different types of fit testing. That's for a whole nother video later on down the road once we go through this. So if you're in a hospital setting and you got patients, or you're a first responder or a fire department, even if you're just a factory and you're going to have your employees mask up, and it's mandated, you're going to have to follow the OSHA 1910.134 guidelines, or you could get fined. It's pretty serious at times when you wear a respirator. Not everybody can wear a respirator, not just because of facial hair, but if you got asthma, emphysema, you got some type of lung issue, there's medical reasons out there why you cannot wear a respirator. So if you're putting these on somebody and they don't know that they're medically cleared, it could be detrimental to their health. So it's very important that you have that initial fit testing. The U.S. Department of Labor has come out with some recommendations. I'm going to read a little bit from the paper here, and then I'll put the source of this in the comments below. That way you guys have that so you can go read that as well. But they're saying the U.S. Department of Labor, Occupational Safety and Health Administration, also known as OSHA, has issued new temporary guidance regarding the enforcement of OSHA's respiratory protection standard. This guidance is aimed at ensuring healthcare workers have full access to needed N95 respiratory protection in light of anticipated shortages. I emphasize healthcare workers because this article is basically about the healthcare workers. They're not really giving us a whole lot of guidance when it comes to the industry side of things. So from what we interpret from reading through this is the industry side, you're still going to need to follow that OSHA 1910.134, or you could be issued fines. Going on in here, OSHA recommends that employers supply healthcare personnel who provide direct care to patients with known or suspected coronavirus or other respirators that provide equal or higher protection, such as an N99 or N100 filtering face pieces, reusable elastomeric respirators with appropriate filters or cartridges, or powered air purifying respirators, which are also known as PAPRs. So that's basically saying is if you're a nurse, if you're a doctor, if you're right up and having contact with anybody with COVID-19, they're even recommending to go past. Don't use the N95. They're saying to go even stronger, up into the P100 mask, these style of respirators with the rubber mask. The N95 is very easily destroyed, and that's one of the reasons they're saying this, because you can only use this for so long, and then you're going to switch it out. If you're working a 12-hour shift or longer, you're probably going to go through 3, 4, 5 of these throughout the day. It may be, and with the shortages right now, if you're not being able to change out when you need to, now you're putting on a respirator that's been compromised, and it's going to compromise your health. So that's why they're recommending to go something like one of these P100 filters. That way these can be reused, you can clean them down, you can wipe them off, and keep reusing them. That way you're not going through the supply, because right now it's hard to get a hold of N95s. Going on here though, this temporary enforcement guidance recommends the healthcare employers change from a quantitative fit testing method to a qualitative testing method to preserve integrity of N95 respirators. So when you go to fit test someone, you're basically wasting one N95 per person that you're testing. So with the shortages, this is why they're saying not to use the quantitative, to go the qualitative. Bad thing is you can't hardly get a hold of the qualitative fit test either. The solutions, the hoods, everything's on back order. We carry those here at AFC, and we're having trouble getting our hands on them. So it's coming down to what can you get a hold of. So you may need to go back to quantitative if you can't get a hold of the qualitative fit testing materials, or find someone, an organization that maybe have a fit tester, and get in and get fit tested. You end up burning one of these, but it's better to know that you have the right fit than anything. If you don't, you'll suffer later on down the road. Going a little further into this here, additional OSHA field offices have the discretion to not cite an employer for violations of the annual fit testing requirements as long as employers make a good faith effort to comply with the respiratory protection standard. Again, going back, they have the discretion not to cite the employer for the violations of an annual fit test. So anytime you're dealing with respirators, you have your initial fit test, and then you have to be tested annually. Or if there's any type of facial features that change, dental work, you lose some weight, at that point you got to retest your employee to make sure that their respirator still fit. So they're saying even with the medical field, you still need to do that initial fit. So if you've never been fit tested before, that has to be done before you can wear these. It's where the annual, your yearly time's up, you got to retest it. They're allowing healthcare organizations to push that back until a later date. They haven't really gone in and said exactly how far. It's just good faith and effort to comply with the respiratory protection standard. So if you're showing that you're trying to comply, that you're trying to keep your employees safe, that you're doing everything you can to keep your employees safe, then what I'm reading here, it sounds like they're probably going to work with you. And it does go into a little bit further in depth. You need to be using NIOSH certified respirators only. If it's not NIOSH approved, then you could be looking at fines. Then once you implement strategies recommended by OSHA and Center for Disease Control and Prevention for optimizing and prioritizing N95 respirators. I say N95 respirators, I'm reading off the sheet here, but we're also including your P100 and your other respirators. And then perform an initial fit test for each healthcare employee with the same model, style, and size the respirator the employee will require to wear for protection from coronavirus. So if you're testing everyone on a small, but you have people who wear mediums, it's not going to fly. They got to have the exact same mask that they're going to be wearing. It may not have to be theirs, but again, same brand, same style, same size. It's very important. That way they know that what they're going to wear out amongst in their whether it's the medical field next to the patients or you're on a factory line somewhere, that it's going to get you the right protection. OSHA is recommending to tell employees that the employer is temporarily suspending the annual fit testing of N95 respirators to preserve the supply for use in situations where they are required to be worn. Again, I'm gathering they're doing this change just to conserve on the N95s. That way you're not burning one. Once you poke a hole in this, it's done, and the only way to fit test it is to put a little probe through here. So if you're doing that, you lost a good respirator. If you got 50 employees, then you just wasted 50 of these, because you're not going to want to put one from one person to another person. So that's why they're gonna suspend the annual fit test. But again, like I said, you have to still do the initial. Going on, explain to employees the importance of conducting a fit check after putting on the respirator to make sure they are getting an adequate seal. Conduct a fit test if they observe visual changes in the employee's physical condition that could alter the respiratory fit, such as weight loss, any type of trauma to the face, dental work, things of that sort. And then remind employees to notify management if the integrity or fit of their N95 respirator is compromised. Say going back, these things can be easily destroyed. It doesn't take much. They're just paper. They're thin. The metal bar in here is going to get worn out after a while. And you're not going to get a proper seal. So when you see, once yours starts going, tell somebody, get a new one. If someone's telling you no, that they're wrong. They're completely wrong, because if yours is destroyed, then you shouldn't be in a hot zone dealing with any patients that have it. Again, this is a temporary enforcement that OSHA is putting out, but they're only talking about the medical field and healthcare workers. They haven't given us any guidance for the industry. I still have customers that are in the industry, and they're still calling to get respirators. They're calling to get gas detection equipment, and they're still up and running. They're trying to keep the economy up, and those are the ones I worry about, because you guys are calling, you're getting these, you're giving them to your employees. And I don't know how many are actually going through making sure you're having a solid fit test done, and making sure the person that is going to be wearing these has gone through the medical evaluation to make sure that they're safe to even wear a respirator. OSHA can come in and find you again if they're not clear to wear a respirator medically. They could be harmed. That's the last thing we want, is anyone else to be hurt over something that could have been avoided. So make sure that you're talking with your employees, you're getting these medical evaluations done. Now, where you're going to be cleared is if you bring in respirators, or your employees bring in respirators, and they're wearing respirators on a voluntary basis. At that point, you're not going to be stuck in the 1910.134. If your employees want to wear them, let them wear them. If you mandate it, be expected to fit test. Either you got to buy the fit testing equipment, or you got to bring it in. Someone who does fit testing, bring them in, or send your personnel out. It can get costly. That's definitely for sure. So make sure you're looking into this. I know it's a scare, but don't rush in and just start throwing respirators at everybody and mandating that they wear them. One employee makes one quick call, you get OSHA in, you don't want them coming in, knocking at your door, finding you. You don't want to hurt the people that shouldn't be having them on and don't know. So just be wise, do a little bit of research. If you have questions on anything when it comes to the respiratory protection, give us a call here at AFC. We'll be glad to talk to you, let you know what the laws are, let you know if you think that you do definitely need to go through and make sure everyone's fit tested, or if it's a voluntary, we'll help you figure some of these things out here. That's what we're here for. We're still open. We're still here in the office. We're going to keep going until either we're all sick or the government shuts us down and doesn't allow us to work. But we're here to support you guys. We're here to support our first responders, our healthcare workers, our industry. You guys are the backbone of our country. Like I said, we're here to support you. So if you need anything, we're going to be here. We don't know what tomorrow looks like or the next day, but we'll make adjustments every day as we need to. That way we can be here for you guys. Make sure you're getting the information that you need. Make sure you're getting the product that you need. If you are needing any respirators, I do not carry N95s. I cannot help you there. I do still have some of the GVS Ellipse respirators in stock. They're going fast. I don't know how long they're going to be here. Out of stock on the Sunstrom pandemic flu kits, which this is the mask and the respirator, the filter that comes in that. Sometime in April is what I'm being told is when we're going to be resupplied on those. Most things are back ordered, so be patient. It's not just us, it's everybody out there. Everyone's trying to get these supplies in, and it's getting a little hard to get some things. So expect some delays, up to 6-8 weeks at times for certain products. So again, thank you for listening. If you have questions, give me a call. 1-800-952-3293 is our phone number here. We'll be happy to answer any question and help you guys out. Stay safe out there.